Welcome to today's episode of CHS Presents Lifestyles at the Heart of Health. Your heart is the hardest working muscle in your body, and there's no question as to its importance in our anatomy. So how do we ensure that we're keeping our heart healthy? What are some lifestyle habits that can harm our heart? And what do we do when surgery is required? We'll hear from expert surgeons. Patients will share their experiences, and we'll get some nutrition tips to benefit our heart. Plus, there is exciting news involving St. Francis Hospital and Good Samaritan Hospital. All of this is coming up on today's episode of Lifestyles. Hello everyone, I'm Jane Hansen. Thanks so much for joining us. Heart disease is the leading cause of death for both men and women. Joining me now with some prevention tips as well as to talk about his work is Dr. Christopher Lamendola, chairman of the Department of Cardiothoracic Surgery and director of the St. Francis Hospital Open Heart Surgery Program at Good Samaritan Hospital. Did I get all of that right?
You got it all right. Thanks so much for having me.
You bet. Sounds like a big job. And I'm sure it is, because it's obviously you save lives every day of the week. I think the big misnomer here is that when I just said heart disease is the leading cause of death for both men and women, I don't think people think that way anymore, but it still is.
It still is. You know, we've made a tremendous number of advances over the years, but it is a killer, and people have to realize that, and it's very important that people understand that they can get heart disease, and it's something that they have to really watch out for.
And heart disease can essentially happen to anyone. I mean, you've told me that you've operated on marathon runners all the way to, people who you thought might get heart disease.
Right. As I always say, there's always a genetic background for patients, and there are people who simply are more prone to heart disease. But many people don't take care of themselves the way they should and make themselves more prone to heart disease. So, it's something that people have to make lifestyle choices that will lead them to good health and good heart health.
Well, this genetic makeup that people have, I know my father had heart disease, and obviously it's something I've thought about my whole life, and he died from it. But he also had diabetes, and he also smoked, as a lot of men his age did. So that all plays into it.
Of course that does, and it makes it difficult for us sometimes to separate out the genetic component of this. But in the end, we're all dealt a certain hand of cards in our genes, and we should make the best of that hand. And that means doing simple things, going to your doctor, making sure that your blood pressure is under control, getting a good diet, getting exercise, doing the things that are important to maintain good heart health.
By the time you see people, there's been some evidence that they might have heart issues, right?
If I am seeing them, they definitely have heart issues.
Mm-hmm. So I guess to get to that point, there should have been kind of something along the way that might have said, I need to make some changes.
Right. Nowadays, heart surgery is a wonderful thing. I think it's been one of the great contributions in science in the past 50 years. But most patients don't need heart surgery. Most patients need to see a physician and have a regular checkup to find out if they have any of the risk factors. The risk factors, obviously, we talked about the genetics, high blood pressure being a risk factor, and diabetes being a risk factor. These are all important issues. So they need to get to a primary care physician or an internist who, if need be, will send you to a cardiologist, and then eventually to a heart surgeon if you need that. Hopefully you don't.
Yeah, right. What is the single most important symptom that somebody might have, though, that they should be really attuned to?
The classic symptom of coronary artery disease is chest pain or pressure or heaviness in the chest. But that's not the only symptom, and often people their first symptom or the preeminent symptom is really going to be shortness of breath. And so when you start to feel that you're getting short of breath and you are having a bit of a problem getting up those stairs, and you're huffing and puffing at the end, you have to start thinking that perhaps there's something more going on. It might not be that I'm just getting old. And, it's something that really requires that you see your physician and have them work it up.
And then obviously you can get tested further and see what
Sure,
exactly is the
there's a
issue.
whole process of testing. And as I said, the vast majority of people are going to need nothing more than maybe a modification of a diet or a lifestyle. Some are going to need a medication. Occasionally, a patient is found that needs something more, and they can have a stent or bypass surgery as needed.
Well, one of the exciting things that's been going on in heart surgery, besides all of the great developments over the last 20 years of your career, is that this new job that you have
Yes.
is at Good Samaritan Hospital, because you've opened up a brand new health center there.
We have, for a very long time, St. Francis Hospital has really set the standard for heart care in the metropolitan area and is one of the top 10 heart surgery programs in the United States of America. One of the problems that we've had, though, is we've realized that Long Island's a long island.
Yeah.
And it's very hard for people in Suffolk to get and to access St. Francis Healthcare. So Catholic Health Services of Long Island made a very serious commitment to bringing that care to the patients of Suffolk County. And we have opened up just recently the St. Francis Open Heart Surgery Program at Good Samaritan Hospital, of which I've been very blessed to be put in charge of. And it's a very exciting time for us because we're bringing our entire staff from St. Francis to Good Samaritan. We're getting
That's great.
some
Bringing
great
it
care.
to the people, so to speak.
Bringing it to the people.
Well, you were kind enough to give us a tour the other day, so let's go take a look.
Sure. Several years ago, Catholic Health Services of Long Island realized that patients who needed open heart surgery are having problems accessing that care. Although St. Francis Hospital is one of the top 10 open heart surgery programs in the United States of America, it is a burden for patients to travel from Suffolk to Roslyn. So we have opened the St. Francis Open Heart Surgery Program here at Good Samaritan Hospital. And what makes this program really special is that what we have done is we have actually brought the St. Francis staff here to Good Samaritan Hospital. This is our unit that we're going to keep everybody on while they're here for their stay. And I'd like to bring you inside, if I might. We have a very special setup here that's not really seen in any hospitals that do open heart surgery in this area. And that is something we call a cohorted unit. And what we mean by that is that every bit of your care will be performed here on this specific unit. So when you come to the hospital and have your surgery, you're brought directly from the operating room to our intensive care unit. And from our intensive care unit, you're brought right here into these telemetry rooms, which are in very close proximity. This is one of our state-of-the-art intensive care units. Most importantly, this room is in very close proximity to all of our nursing stations and monitors. So when you're in a room like this as a patient, you have very, very close and attentive care. Each of these rooms actually has a special type of glass that divides it from the room next to it. And this glass is opaque, so the patients have privacy, but when needed, we can flip a switch and it becomes completely transparent. So our nurses can always keep an eye on a patient right when they're in the next room. And we think that's really important. And it's one of the few places in the New York area that has something like this. This is one of our state-of-the-art operating rooms. These rooms, two of which we have in this same location, are world-class operating rooms that have been specially constructed just for open heart surgery. As you look around, you can see there's a lot of technology in a room like this. Everything from our anesthetic setup to our advanced monitoring. You can see these special booms with all of our peripheral equipment on them. As we move around the room, though, we can see other parts of our setup, and nothing is more important than this machine right here. This is one of our heart-lung machines. And it is with this machine that we're able to place patients on cardiopulmonary bypass and do open heart surgery. So as you can see, this is a state-of-the-art, world-class operating room here at the Open Heart Center at Good Samaritan Hospital.
So hopefully you'll never need our services, but if you or a family member does, we want you to be assured that you're going to get the finest care here.
It must be really exciting to have that facility where everything is brand spanking new.
It is exciting. It's wonderful to have a facility like that. You know, it really is very, very high tech, and it's very important, I think, to have patients in one area where you can really keep an eye on them closely. You know, it harkens back to the days of the old ward, actually, in hospitals. But there was some real good care given on wards many years ago because, you know, they had the head nurse who would keep an eye on the patient, knew everyone on the ward, and that's kind of what we're trying to duplicate, and we think it's important to do that.
So if somebody comes to you and they said, I'm worried about my genetics, I'm getting older, or there's all, you know, I just am worried that my heart, my ticker may have some issues, what do you tell them?
Well, I tell them, first of all, it's very important that they have a physician that they trust, to get to a family practitioner or an internist who can follow them, get to know them over time. The internist or family practitioner they're seeing is really going to be able to determine those risk factors and what level of observation and what level of testing they need to find out if they do have heart disease. Certainly one of the great advances in heart disease of late has been statin therapy. You've heard about it on the news, Lipitor. Mm-hmm. It is very important, and we are finding more and more that it's important in patients who have just modestly elevated levels of cholesterol. So you may benefit from that even though you're otherwise fairly healthy. So these are type of things that only a doctor can really discuss with you. You really need to get to somebody to be checked out.
And what about lifestyle changes, though?
Probably the most important thing you can do is a lifestyle change. You
and
know,
simple.
Simple. And you know, as I always say, I talk to people all the time about their diet, about exercise. I don't like to say that people should go on a diet. A diet implies that there's a start and a finish. Mm-hmm. And that's not what we want to do. We want to change our lifestyle. But you also have to be realistic. It's hard for patients to just simply say one day, okay, I'm never going to eat this, or I'm going to get up at 5 in the morning every day and go running. So what I encourage my patients to do is what I call simple steps. Just try and take one thing at a time. Just make a small change. Instead of riding the elevator 3 floors, just walk up the stairs. Get up in the morning, go for a walk instead of sleeping in. Do things that you can deal with that become part of your lifestyle before you move to the next change.
Next big
and
thing.
You know, this is, as I say, this is a marathon. Your life is a marathon. It's
right.
not a sprint. You don't have to change it all next month. All right. What's most important is that you change it so that the change stays long term. And you can take a year or two to do this, but really do what's needed in the way of diet and exercise to make yourself healthier.
What is the feeling like as a heart surgeon when you've operated on somebody 5 or 6 days later, they get up, they go, leave the hospital, and then they come back to see you and their life is completely changed? What is that feeling like?
There's no better feeling in the world. There really isn't. You know, it's very special to know that you've had an important influence and contribution to someone's life is a very special feeling, and it's, in truth, it's why I do this.
Yeah, I'm sure it is. So congratulations on
Thank you so much.
On the new center at Good Samaritan, and I'm assuming that anybody who's in Suffolk County that needs that care can go there instead of traveling all the way into St. Francis.
Absolutely.
So thank you, Dr. Lemondola. It's very nice to have you here today.
Thanks
you
so
for all
much,
the good
Jane.
work you do. We were going to take a little break, but still to come, heart surgery has saved their lives, and now these volunteers are going to share their experience with us. Also coming up, some heart-healthy recipes. We'll be right back. Welcome back to CHS Presents Lifestyles at the Heart of Health. Heart surgery can reduce symptoms, improve quality of life, and improve the chances of survival. Joining us now to share their stories and the experience of the care they received at St. Francis Hospital are Earl Johnson and John McCarty. Thank you both for being here.
My pleasure.
Now, this is like a reunion, is it not?
This is a reunion.
Because you operated on both of them.
I did. I operated on Earl in 2004, and I operated on John in 2001.
And you met John in a very interesting fashion.
I did. John and I met actually on a golf course. I was taking a course in heart surgery, and we were out on a golf course one day, and John was partnered with us. And John was the only one who could actually golf. But we got to know each other, and not long after that, I had given him my card, and he contacted me because he was having some issues with his heart. And sure enough, we were hoping it wasn't going to be heart surgery, but it ended up being heart surgery.
Yes,
And that was 13 years ago?
13 years ago, exactly.
And everything went great?
Fantastic. It was, he had me back on the golf course in 10 weeks.
Wow, that's a great recipe for success right there. But how unusual. I mean, that's just so ironic that actually happened like that. Great story.
It's amazing.
And Earl, you were suffering from, you had prostate cancer a short time before you ended up having heart surgery.
5 months before the heart surgery. And I was taking medication for that surgery, and it gave me a dry throat. But only when I used to do 5 miles of walking a day. And on the weekends, when I went with my wife, we'd do 5 miles, and then I do another 3 at a faster pace. And I always got a dry mouth. So what happened, in 1998, I had a blockage, and they put a stent in. So, I had a little heart history. So I called my cardiologist, and he told me, you have to come in. We have to look at that more thoroughly. Even though I had thallium stress tests before the cancer surgery, because I wasn't taking any chances.
So this was a surprise. You get there, you're at the hospital, you're having a test, and he says, you're having surgery tomorrow.
Yeah, because in those days we were still doing the catheterizations. You were awake. They just gave you something to relax you so you could watch everything go on. And that's what he said. He says, you need open heart surgery.
Well, I didn't actually have a heart attack. I simply failed a stress test and had the angiogram, and I never left the hospital.
Yeah, well.
Because I knew Chris, and next morning had the surgery.
Yeah, well.
Which is amazing.
Good thing you met him.
Absolutely.
So you guys had such a great experience at St. Francis that you actually now spend a lot of time there as volunteers.
Yes.
Right.
So what's that like?
Well, after that experience, I said, I have to give back to this hospital. The care I got from him, from the nurses, everybody. I said, I have to pay back. And I did, and I volunteer there twice a week, and I love it.
And what do you do exactly?
Transportation. I help the patients leave.
Oh, the best part is when they're good enough to leave the hospital, right?
Exactly, yeah.
And how about you, Earl?
I spend a lot of time in we used to call it the surgical waiting room, where the families are waiting for Dr. Lamondola to call them back.
Nervous.
Forget about it. They're like really wired. And part of the thing is, we can't tell them much because it's an individual thing. I might have pain, he doesn't have pain. So we don't go into that too much. But just the idea that I'm standing there talking to them, it sort of reassures them and they feel a little better.
Sure, I'll bet, because while you're in surgery with them, is there a typical time for open heart surgery?
About 4 hours usually, typically.
It's got to be just the 4 most wrenching hours for a family to sit there.
Absolutely. You see the relief. I'm sure you guys see it when I come out to talk to them. The relief on their faces when I come out and there's a smile on my face. They know right away, and it's just that you can see everyone a group exhalation. Okay.
Well, what's amazing is that the staff, the nurses, all the people there, when they say goodbye to the patients, they're so appreciative about the care they've received, and you can see it in their faces.
Yeah.
It's
And so
marvelous to see it.
do you give them any words of advice about, here's what I did after I got out?
Well, you feel like you're showing off. I don't want to do it too often, but take your meds, try to get to a gym if you can.
Yeah,
you must do that, because you can
definitely.
come back within 6 months. You really can, and I've seen it happen.
Now, the volunteer program, can anybody get involved? Because I'm assuming that you're going to be having this at Good Sam now, too.
Yes, absolutely.
They screen them fairly well. There's a waiting list, actually.
Really?
And we have about 400, 450. It's up there now.
Quite a few
Really?
volunteers.
There's a waiting list, and it's basically retired teachers, police, firemen, a mixture of people.
The vast majority of them have had surgery or
They have.
intervention.
Oh,
at
they
St.
knew somebody who
Francis.
had it.
I guess that must mean you did a good job, that they're willing to come back, right?
They're lining up to volunteer. It's
Right,
a great thing,
exactly.
and we appreciate these guys so much, and all the volunteers so much, because they make it so comfortable for the patients, and it's a really important part of the St. Francis experience, and I love that these guys got involved.
Well, we're really grateful for the fact that you're here with us and that
thank
you're
you.
telling your story and sharing your experiences and that you're volunteering. And it doesn't sound like you could do your job as well without them.
I certainly couldn't. I think they're just a wonderful addition to the hospital.
And congratulations on your successful surgery. It worked.
Thank you. Yes,
We love what we do. Thank you for having us.
Thanks all of you for being here. We really appreciate it.
Pleasure. Thank you.
We're going to take another break, but don't go anywhere because a healthy diet and regular exercise, key to a healthy heart. And we've got a heart-healthy recipe coming right up, so stay tuned for more. CHS presents Lifestyles at the Heart of Health. Welcome back to CHS Presents Lifestyles at the Heart of Health. A healthy diet and regular exercise are keys to a healthy heart. Joining me now is Marina Stauffer, a registered dietitian from St. Catherine of Siena Medical Center. And she's going to give us a little cooking lesson today in making bean burgers. Bean burgers?
And I call them bean healthy burgers. Being healthy.
Being healthy.
So,
got it. Oh, you're so clever. So let's just, before we start, just one quick thing about
Sure.
what should people really do to their diet to become healthier heart-wise?
You definitely want to focus on more whole foods, things like fruits and vegetables that are in the least processed form, the things you find in the produce aisle, and start from there. Also whole grains, beans like we're using today, they're very high in fiber and they help to take out some of that cholesterol out of your blood system.
So any vegetables? I mean, potatoes are okay?
Potatoes are fine, but you want to make sure that
They're
is
not
the
French fries.
starch, right, that they're not fried, and that's the starch portion of your meal, that you're not having half of your plate potatoes and then you're having a little bit of pasta with it.
All right. So I happen to love beans, and this is a great substitute for hamburgers.
Absolutely.
So get started. Tell me what we're doing here.
So it's very easy, and you can make a lot of different substitutions, which is what I like, because I never like to run out of this house to go to the store.
Right, because you can do this. You might have a can of beans, and you can just simply use a can of beans,
Exactly.
right? Okay.
So we've got black beans. You can use any beans at all.
I happen to just think this is a great idea. Black beans.
And we're going to put some oats, just a little bit, and that helps
Oats?
bind it together.
Like oatmeal? Or?
Exactly.
Okay, any particular
Rolled
kind?
oats. Old-fashioned is the best, but you can also go with the instant if you have to.
Okay.
Then we're doing some onions, and also garlic is in here.
Onion and garlic, okay.
And then just good old grated carrots.
And these add a little sweetness, right?
Yes. A nice flavor.
And what's this?
That's parsley. You could also use cilantro if you like.
Right, whatever you choose.
Exactly, whatever you have. And parsley freezes really well. So buy 1 or 2 bunches, wash it, chop it up, put it in the freezer, and you can always have it ready.
And last but not least,
This is chili powder and a little bit of salt and pepper. Not a lot.
not a lot, because you want to avoid a lot of salt.
Exactly.
Okay.
You can also use curry powder or something else. Get creative with it.
So you can do whatever you want for your taste buds. and-
Absolutely.
Yeah, okay.
Yeah. This is a little spicier because I like spice. That's just me.
I think, well, especially if you're going to take away a burger and put bean burgers, spice might really help.
Right. Definitely. It helps
Okay.
flavor it up. So I'm putting this in a food processor. You can also use a blender if you want. But you're going to pulse it enough till it's combined, not too chunky and not pureed.
Okay.
So a happy medium.
So a happy medium.
So I'm going to get this going. So now I'm just going to shape these. And this is great for kids also if you want to get them involved in the kitchen. It doesn't. There's no salmonella or E. coli in here, so you don't have to worry about having to wash your hands before tasting it. So anyway, I'm just going to shape these into patties.
Is there a way to disguise them so kids will eat them without knowing that they're getting something that's nutritious and good for them?
Well, first of all, if kids, if they tend to, I'm just going to put this in here.
Okay.
If they help out in the kitchen, they're more likely to taste what you're putting out for them.
Right.
But also, if you serve it up like you'll see in a minute, it's hard to tell that it's a veggie burger or a bean burger.
I tend to like to make chicken burgers, and I put vegetables in with the ground chicken. Is that healthy,
Right.
or should you not?
No, that's fine also. Whenever you're making chicken or turkey burgers, try to use the white meat.
Okay.
But yeah, adding vegetables in there can definitely help season it up, make it taste really good.
Okay, good.
Yeah,
All right.
great
So
idea.
now, how long do these cook?
So I'm putting this in a skillet. You can put it in a grill pan with just a teeny bit of oil.
But you don't have to be worried about the oil, adding some fat and things to it.
Oh no, this is such a tiny amount. I'm using maybe a tablespoon of oil for this entire recipe, 8 burgers.
Wow.
So
8 burgers?
Yeah.
We're going to feed the whole crew here.
So I'm just going to put these in, and they cook for about 3 minutes on each side, just until they warm through.
So of course, with the magic of television, we've already got some prepared.
Of
because
course,
you're
as
not getting
always.
out of here without me tasting it.
So over here, let's take this platter.
Now, what is this? You've made something to put as a topping.
Yes. So since these are bean burgers, a lot of people have a hard time thinking, oh, well, I'm not having my beef. What am I going to do? So I like to add some toppings that they normally might have on their burger, which are caramelized onions and mushrooms. Who doesn't love that?
Exactly.
They
me too.
have-
And how did you make these? Again.
I just sauteed them with just a teeny bit of oil and just a teeny bit of salt again to bring out the moisture.
Okay.
And very easy. You
Well,
can have that going on the side with this.
Right, looks good. All right, so, and then you're just simply going to put what, a little bit of,
I'm taking some arugula to add a nice spiciness.
and you also talked about the bread. I don't think we've mentioned that yet.
Right, so I'm using these sandwich thins, you can see, and they're very low in calories compared to normal hamburger buns. They're also whole wheat, so they have a lot of fiber in here, and you're having a lower calorie burger overall.
That's great. I love it. All right.
So on some of these, I put some Swiss cheese, like I
And
said.
Swiss is because, what should you put first, the onion or the onion first?
Right.
And Swiss is it's okay to have cheese? I thought cheese was a problem.
So Swiss cheese is one of them that are always very low in sodium, and they're also low in fat. You can also get a low salt Swiss cheese. So you're just putting half an ounce on each burger, and it's a great way to flavor it up.
Got it. Sounds great. All right,
Perfect.
I am going to
Beautiful.
invite John and Earl and Dr. Lamandolo to come back in here, and we're all going to sample a burger because I know they've been sitting here eyeing them. I could see their mouths were watering. And you would highly suggest this is great for people to eat, right?
This is great.
So,
This is great.
Marina, thank you so much. And of course, the recipe is going to be on telecaretv.org. All right, guys, come on, dig
Thank you,
in,
thank you,
grab
thank you.
one. I want to see what you think.
The verdict
And
is.
if you can tell if it's not a hamburger.
Well,
I think
Murphy's
they're
Law is
delicious.
excellent.
I'm
Very
going to
good.
try
They're
these
delicious.
at home myself. Thank you so much, Marina.
Thank
you,
you.
Dr. Lamandola. Thank you
good.
Thank
to
you.
Earl and to John for
Thank
being
you.
here. We appreciate everything you've had to tell us today. It's been a lot of fun. For more information or to schedule an appointment at one of Catholic Health Service's 6 outstanding hospitals, you can simply call 1-855-CHS-4500 or visit chsli.org. Thank you so much for joining us today. Go make yourself a bean burger. I'm Jane Hansen wishing you goodbye and good health.